Solutions where you take 1 part to 99 parts, where it's 1 to 100 dilution of the tincture. And those are the ones that are most commonly used, and those are the ones that I'm going to be discussing tonight. But there are also these X dilutions that you may see also, which are dilutions to the factor of 1/10. So not as much of a dilution, 1/10 dilution each step. Okay, and then there is you might see a K that refers to just a manufacturing known as Korsakovian method, and this is a dilution at the rate of 1 part of the previous dilution with 99 parts of solvent. So that's just more technical information, but just so that you're aware, if you see these dilutions in the store. Let's see here. Okay. So, there's been a lot of skepticism around homeopathy for a very long time, and a lot of it arises from the lack of knowledge and understanding of how it works. And most of these remedies, involve so much dilution that not a single molecule of the original substance remains. So how can this possibly work? And there has been research. There was a French immunologist by the name of Jacques Benveniste, and he did some work which was then confirmed by a Nobel Prize winner, Luc Montagnier. I don't know if I'm pronouncing the names correctly, I apologize. And he confirmed the work of Jacques Benveniste that showed that the diluent somehow remains imprinted with the original substance in the form of electromagnetic waves. Okay, so now we do have some understanding of how it's possible that you can, have not, even a single molecule that you may be able to detect, and yet still have this effect. So there is evidence, and there are also a lot of studies out there showing the effectiveness of homeopathy. So homeopathy is used worldwide. In France, it's used by 51% of the population, prescribed by 32% of physicians, and it's reimbursed by the national healthcare system. In the UK, they have 5 homeopathic hospitals, and India is used quite widespread. 25,000 homeopathic physicians, used by 300 million patients, and 400,000 healthcare practitioners. So it is really very popular outside of the United States. The United States, I think, there's some popularity, but definitely in outside the United States, there's a lot of popularity, particularly in these countries. And there's more countries. I didn't mention all of them. Okay, so these homeopathics in the U.S., they're manufactured in strict accordance with Homeopathic Pharmacopoeia of the United States, and that's the HPUS, and Drug Good Manufacturing Practices. It's been used for more than 200 years, and they have a remarkable safety record, and no known side effects above 4C dilution. And this is really what I love about homeopathy, is the fact that the side effect, not just the side effect profile, but the safety of these medicines are so good, and it's very good for especially patients who are very sensitive to medications. I'm very sensitive to medications, and this is what drew me to homeopathy, because I will have every side effect of a drug that's listed, and so with homeopathics, I've never had a side effect with it. There's no risk of overdose here, and they don't interact with other medications, which is nice, because that's a very common problem with a lot of other types of medications. So it's available as single medication, medicine, or specialty medicines, which contain multiple active ingredients. Tonight, I'm just going to be going over single medicines. I'm not going over some of the specialty ones, although there's a lot of good specialty ones out there, just so that we can kind of get a taste for, for the homeopathics individually. Okay, so let's go ahead and start. So number On my list of top 10, I chose Oculus. How many of you are familiar with Oculus? No? Okay. So there's a nice picture of the Oculus, and what it is it's the dried fruit from a fishberry or a levant nut, which is a small shrub from India and Ceylon. And if you were to ingest this, it would cause nausea, dizziness, weakness of the neck muscles, low back weakness, and a sensation of the knees giving up. Now, just to clarify, I am not going to go over every single symptom associated with each of these, because in general, the homeopathics have so many different applications, and there are an innumerable number of symptoms. So I just am limiting it to the kind of the main ones that I use it for. So there are and for some of these ones that I'm going to be discussing, there's a lot more indications, a lot more symptomatology, but I'm just kind of going through the main ones. So I just want to clarify that, because there's just not enough time to go over all of them. So because of that, the homeopathic clinical indication that that's useful for is number one, motion sickness, and car, which could be car sickness, seasickness, and it's quite effective. And I've given it to quite a number of patients and friends who've been quite happy with its effect. I had a friend who went on a cruise and didn't have to use anything else besides the Oculus. And the nice thing is it doesn't have any side effects, make you drowsy like some of the other ones out there. So that was nice. I use it quite frequently as well for vertigo, especially positional vertigo. This is actually pretty, I would say, pretty common or not uncommon to see patients with vertigo. It also can be used for jet lag, and I haven't personally used it for jet lag. There are other ones out there for jet lag, but it is one of the indications for jet lag. And also insomnia following a late night, where you may have these symptoms. So these are the main indications, and usually for this indication, I will give a dose of 30 C dilution, and again with the pellets, it's usually I usually use like 5 pellets as a homeopathic dosage. Okay, so next, number 9 is Mercurius Solubility, and as you can see, this is a homeopathic of mercury. Okay, so everybody knows that mercury is toxic, right? Okay, so Hahnemann's soluble mercury is a grayish, acrid powder, practically insoluble in water, and alcohol, contains 85% mercury. And there are many, many symptoms. This one definitely has pages of symptoms from mercury toxicity. So really, I really limited the symptoms that I put on here in this situation, to inflammation of the mucous membranes. So as a main clinical indication, I give this homeopathic for sore throats. It works really, really good for sore throats, tonsillitis, and as well as some rhinitis. My first experience with Mercurius Solubility, I remember distinctly, I woke up one morning and I had this awful sore throat where I couldn't even swallow my phlegm. And just that really bad sore throat, which I don't usually get, and I happened to have the Mercurius Solubility, which I hadn't used, and I put some under my tongue, and then I was just kind of lying in bed, just trying to go back to sleep, and then about literally within a couple minutes, my throat felt so much better. And at first I was thinking, well, maybe it really didn't hurt that bad, because that can't be right. How could it possibly work that quickly? So, you know, it really was one of those times that you know, experiences that I had with homeopathy that really made me a believer, because it was just almost magical, you know, it just worked so quickly and works so well. So it's a really good one. There are other ones out there for sore throat. It's not the only one, but this is one that I do frequently give to patients. And I usually give it in a dilution of 9C or 6C. If you buy, you know, a lot of these in the stores, you're not going to find the full range of dilutions. Usually they'll have like 6 and 30 in the stores. So we carry, you know, some more of the different other dilutions here. So 9 and 6 are equivalent, and that could be given every 2 hours or so, and then you gradually increase the interval between doses as symptoms improve. And and I don't think I mentioned this earlier, as far as the dilutions go, this is something that is probably not logical when you think of it, but as you dilute it, you know, as we discussed, as you dilute it more and more, it actually becomes more potent, so that a lower dilution is not as strong as a higher dilution. Okay, so next, is it number 8? Is Nux vomica. And this is, I have a picture here of the fruit that it comes from, and then the seeds. It comes from the dried seeds here on the right, and it is the strychnos, seeds of strychnos, which is an evergreen tree native to Southeast Asia. Contains strychnine and brucine. Symptoms of this would be toxic effects on the nervous system, resulting in agitation, anxiety, hypersensitivity to light, noise, odors, cold, and spasms in the digestive tract. So the indications for this, I use it quite often for dyspepsia. That's a quite frequent complaint patients. And I've used it myself for that. This is one of the ones, actually I think this is the very first homeopathic I ever tried, because I did have long time ago a lot of issues with the digestive system, and so this actually was one of the very first homeopathics I tried, and it really, you know, did help. And then there is, it helps with a certain what we call sensitive type, a hypersensitive, impatient, irritable, intolerant individual who drinks too much coffee, too many stimulants during the day, and then can't sleep at night. And it's kind of like a type A personality, and I'm sure we all know people like that. And this is perfect for someone like that. In homeopathy, I'm just going to go really briefly into it. There are certain homeopathics that are that fit certain types, and we call them, you know, the sensitive types. So this is one of the homeopathics that fits this kind of description of an individual, and so that would be this would be the homeopathic that this type of person would take to help with all of their kind of symptoms. And then the other indication that I've used it for, which has worked well, I haven't used it myself for this, is a hangover. I gave this to a person, I should, who will be remain nameless, and he was going on a trip to, originally he was supposed to go to Russia, and you know, he was planning on having a nice drinking fest there, but didn't end up there, ended up in Alaska, but still had the same fun. And I gave him some Nux vomica to take with him, and he attests that it worked very well. So that's also, you know, of course, it's not good to have a hangover, but you know, if it happens, it works very well for that. So anyway, the dilution for acute, it would be a 9C. And then for the 30C would be for like the sensitive type person, and as well as for, it's also very good for insomnia, and the 30C dilution. Especially difficulty staying asleep. Okay, so next is borax. Okay, and this is, as you can see, the picture is actually of sodium borate. And this is an odorless white crystalline powder. It has an alkaline taste. It has actually long been known for action as an oral paste for office ulcers in infants and as a mild antiseptic gargle mouthwash for sore throats. So this is the symptoms with borax would be a burning in the oral mucous membranes with painful blisters, ulcers, and herpetic eruptions with like clusters of small blisters. So the main indication, clinical indication, is cold sores. And how many people get cold sores? I have people telling me they have cold sores, all the time. And this can be oral, but it could also be related to herpes, both in the mouth or in the genital area. And I've used this myself, and I've used it on people here in the office, and it works great for a cold sore. There is another one that I'm going to be talking about that can also be used for cold sores, but this is one of them, and this is a really great one. This is one I would definitely just keep in your pocket and have around if you do get cold sores. Okay, so, sorry, hold on one second. So I apologize, but we have to take a 5-minute break, and we'll be right back.
Arnica, yeah, Arnica I knew about.
I never knew to take 5.
All right, we're back.
Okay.
Thanks so much for being so patient. So I think we finished here with the borax, and let's move on to the next one. Okay, so the next one, Rus Toxicodendron. So anybody want to take a guess as to what this is? Anybody recognize this?
Rose?
What's that?
A rose?
A rose? No?
Skin psoriasis or poison ivy.
Oh, you mean what the... Oh, okay.
Right, what is it?
The poison ivy.
This, and then this is associated with this. Right.
Poison ivy.
Poison ivy, exactly. So this is kind of like one of the classic examples I love to give when I talk about homeopathy. Here you have poison ivy, and here's what it looks like. So, the symptoms: an intense, swollen, blistery rash, pain, and also can cause painful stiff joints that are improved by movement. So this would be the perfect remedy for poison ivy. And I don't think I've treated poison ivy, though, actually, in quite a while. So what I've mostly given this for is for things that look like poison ivy rashes, which shingles, and again, herpes, oral or genital herpes, can look like this as well. Chicken pox. I haven't seen a case of chicken pox in a number of years, but this would also be good for that if it has these characteristics. And then for the the painful stiff joints, it's also very good for tendon pain, like a tendinitis or a sprain. And I use this homeopathic very frequently for that as well. So those are the two main indications with the skin and then the tendon. And the dose on this is usually I usually use a lower dilution, a 9C. A 6C as well could be used 6 times a day every 4 hours, even more frequently in the beginning if needed. So So that is loose tox. Okay. Next is Arsenicum album. And this is, I don't know if you can see the picture because it's actually a little bit, maybe you can see it's bigger on the screen, is arsenic, which is, as we all know, poisonous. And actually the picture of the white powder is arsenic trioxide. It's a colorless crystalline powder with a slightly acidic taste, and it is a very strong poison. Symptoms, again, I'm just listing a few of the symptoms because there are a lot of symptoms associated with arsenic poisoning. Irritation of the digestive tract with vomiting and diarrhea, irritation of the respiratory tract, the urogenital tract, and can cause cystitis and vaginitis. And so the main clinical indication of this homeopathic food poisoning, acute gastroenteritis, so nausea, vomiting, diarrhea, works wonderfully. And I always carry this with me. This is one of the ones that I carry with me everywhere I go, because you just never know, with not just yourself or somebody you're with might have some food poisoning. And also very good if you're traveling, for traveler's diarrhea, I recommend this to patients when they travel to take this with them in case. So this is just one of the ones that I always usually have on hand. It also can be used for asthma and acute cystitis. And I have used it as well for some patients with asthma. And the dose here is a lower dilution of 9C or 6C dilution can be used. Okay, so next, calendula. And this is a nice picture here of the calendula, which comes from the garden marigold, which has the orange, yellow, gray flowers. And the actual calendula is prepared from the upper part of the flowering top of this flower. And symptoms caused are usually pain that's out of proportion to the extent of the injury. And generalized weakness, much more debilitating than expected. Most of the descriptions in calendula are of its favorable effects. Calendula is also used in the herbal world as well. So it's been around for and well known actually by many, not just in the homeopathic arena, but other arenas as well, as a wonderful wound healing substance. So really good for burns, sores, fissures, abrasions, cuts. So this is something that, and again, if you can use it it comes in ointment form, but it also can come in the pellets. And so usually I more often use the ointment, and I have this around with me. This is another one that I carry with me everywhere I go, because I guess I don't think I'm prone to burns, but inevitably, everyone you get a cut here and there. If you're cooking, you get a little burn. So it's wonderful. It's just one of the ones that I would just always have around. It would be, I use it in place of, like, say, where I might have used like Aquaphor before or something like that, something equivalent to that. This is, I feel, is even better. So I really like this one. Okay. All right, and I forgot what number we're on here, but oscillococcinum, the one that nobody can pronounce. And I don't know if I pronounced it correctly, because everybody actually pronounces it differently, and I just call it oscillo for short. So, why do I have a picture of this duck here? All right, because oscillococcinum, you may or may not know, is Anis barberi, and it comes from the extract of the Muscovy duck, liver and heart, which is probably, I think, may be a surprise to some people. It causes flu-like symptoms. So it treats flu-like symptoms. It's pretty straightforward. Body aches, fever, headache, chills, fatigue. This is probably one of the best, most well-known homeopathics, and also well studied. There has been double-blind, placebo-controlled clinical trial with this homeopathic, and it's shown to work rapidly, with 63% of patients showing complete resolution or clear improvement at 48 hours. Now the trick to this is that you have to have it around and take it as soon as you start feeling it, because it will work really well. If you wait, the longer you wait, it won't work as quickly or maybe as well. So it really can make a big difference as far as how soon you start it. And so the oscillococcinum I just carry with me everywhere I go, and in case and you can use it for the treatment of flu, but I also use it preventively. I tell my patients during flu seasons, you can take a dose a week. I usually just take a dose if I'm exposed to anybody who's sick. I take a dose before I get on a plane. And so, it can also be used that, and it's not just flu, but it's very good for, viral type of, any type of viral infection, or cold as well. So it's one of those ones that you just want to have around.
And what's the dosage on it?
Oh, actually this one is, there's just one dosage on this, and it actually comes in these little tubes with the tiny little pellets, smaller than the normal. So it's just a tube is a dose. It's one dose, and you take the whole tube. I had somebody try to take out one of the balls that were in there, and it was they didn't understand they were supposed to take the whole thing. So it's the whole tube is one dose. It's a unit dose. Okay, so we're almost done. Okay, I did number this one here. Okay, so we're at number 2. We're almost done here. So number 2, Arnica Montana. This one also very well known by I think actually a lot of people. This one is a perennial plant, grows primarily in the mountain pastures, and although it's non-toxic, it does contain this sesquiterpene lactones, which can cause contact dermatitis. So it's used, the symptoms it causes are aching of the muscles, bruises, cramping sensation, and it can also cause blood extravasation in the capillaries. So the main clinical indications here would be any type of trauma, falls, wounds, accidents. It can be used for pre and post-surgical care. We do use it here in the office as well for before and after aesthetic procedures to reduce any bruising. And hemorrhoids, it also can be used because it does help, it has an effect on the capillaries, and also painful varicose veins or phlebitis. So sometimes a lot of people might know about the bruising, but they don't realize it's also very good for the action on the capillaries. And so this is used very, I use this, there's just so many uses for this. So this is what I actually carry around with me all the time too. And it's very popular amongst people who play sports. They use this very frequently. And I forgot to put the dosing on here, but it comes in the pellets as well as the oil. Comes in a gel or a cream. And actually, I'll have patients do both. I think you get the best effect if you do both. So you do the pellets and then you rub on, and again, this one I've had some really, miraculous experiences with this if you use it right away. again, a lot of time with this one too, the timing can be critical, because the sooner you use it, the quicker it can work, and really, you could get a bruise that you don't even know you had a bruise. So it can work that quickly if you use it right away. So it's kind of nice. So that's why I carry it around with me. So it's really one of my favorites. But I put this as my as number one homeopathic Apis Malefica because of its versatility. So Apis Malefica, as you can see from the picture, is actually comes from honeybee, and it's actually a whole crushed honeybee that's used to make this homeopathic. So if you think about honeybee, a sting from a honeybee, it causes a reddish pink swelling and burning, and it's usually relieved by cold. If you have a cold compress, it feels good, right? So if you think about that picture, then it would be the perfect antidote for a bee sting or any other type of sting or bite that would have these characteristic symptoms. And I sure wish I had this when I was growing up, because I had a lot of bee stings growing up, running around barefoot in the yard. So this would have been great but had I known about this. Fortunately, I didn't. But what also looks like this would be a first-degree burn. So a burn also has the same characteristics, right? And also, or sunburn can have the same characteristics, symptoms. And so I've had some very good experiences with this as well. I mentioned the calendula. Usually the calendula and the apis together for a burn are just the best pairing. So I usually use those. I'll have both of those. I'll put the calendula on, and I'll take the apis. And you won't, in some instances, I won't even know that I had a burn. It's like that, and it can work that well. Especially, but if you use it early enough. Sometimes if you wait, and then it may not work as well. So, and then it also can be used for hives. If you think about hives. Similar symptoms with raised, swelling, over the body. So it can also be used for that. It can be used for swelling in the nose, like a rhinitis, or swelling and redness in the throat with a sore throat. So it really has so many different uses, and I've actually used it for all of these, and it works great for all these indications. For the dosing on this, it would be a higher dilution, 15 or 30 C is what I recommend. And you can use it every 15 minutes, actually. And if you use it right away, it can really ameliorate symptoms very quickly. So every 15 minutes you can do it until the symptoms kind of subside, and then you can space it out accordingly. So that's my favorite one. And honestly, because I've used it so much. I've used it for a burn, and I used it one time as well for, I think I just slammed my finger into a drawer, and I just started taking the apis, because I could tell it starts already to swell up right away, and after, I think I actually ended up having to take quite a bit. It was pretty bad, like it hurt really bad, but probably by an hour later, you could barely tell that I even had slammed it, and it wasn't even hurting. So that was another instance where I was really pleasantly, not surprised. I knew it would work, but it was really, I was very happy, because it hurt. So that's the end. Any questions that you guys have about homeopathics?
So it sounds like a lot of this is almost the way they make vaccines, right? Don't vaccines come from like a virus, and they dilute it and give it to you?
Well, no, yes, but actually they dilute the vaccines, but the vaccines contain so many other things in them. Okay, And so it is very different than a vaccine. And again, you're not injecting, these things. So,
I was just wondering because it sounded like that. You know how like the symptom, like
Right,
they take a virus and then they give you a virus, right?
exactly, right, exactly. Well, they're taking a component of it and then they're giving that to you. So in some ways, yes, it's similar, but it really is quite different than a vaccine.
And what about no side effects? Like you were saying to take the osteocilium stuff. I mean, like there's no side effect. You could take that and not worry about.
Exactly. It's very safe, and there are no side effects associated. As I mentioned, above a 4C dilution, we don't worry about any type of side effects. And the oscillococcinum, it's like a 200, but they put 200 CK dilution, so it's quite diluted, so there's no concern for any side effects. So, yes.
Do you have any tips on how to decide which, like you mentioned, you slammed your finger, so you took the Apis. Why did you decide to take that and not the Arnica? I'm never sure,
Oh, well, actually, Arnica, I probably would have taken Arnica, but I didn't have it.
Okay.
I just happened not to have the Arnica on me, and I just had the Apis.
Okay.
And the Apis worked beautifully for the swelling, and so I would have taken Arnica too. I would have probably taken both had I had the Arnica on hand, and I just didn't happen to have it. Like I usually do have it, but I didn't happen to have it, so I just took what I had.
Okay, and so like the same for like, I'm gonna make me say it.
Toxinum?
Thank you. Versus like cold calm. Because at first you don't know, am I having a cold or is this going to turn into like a full blown flu kind of thing? So
Sure.
I always reach and I'm thinking, which one should we start with?
Okay, so the question is, oscillococcinum, when to take that versus cold calm. Now I didn't talk about cold calm, but cold calm is one of those dose homeopathics that have multiple different homeopathics in them. And so the cold calm is, what I usually do is I recommend that you do a dose of the oscillo, and then the cold calm is, the specific symptoms. If you have congestion, runny nose, the classic symptoms of a cold, then you start taking the cold calm. Usually the oscillo, I'll start taking it as soon as I feel the twinge of something coming on, like, you just like, usually before you actually get the symptom, you kind of feel maybe worn down, you feel a little achy, or you just feel tired, and then that's when I'll take the oscillo, and then if I start developing the actual symptoms of like a congestion, runny nose, then I'll go ahead and start taking the cold calm. And you can still continue the oscillo with the cold calm, and just alternate them, especially if you feel better with the oscillo. So, and on the, I think on the instructions they say you can like 3 times a day, but I've used it a lot more than that, and it works wonderful. And like I said, because you can't overdose, I just take it when and I'll immediately feel better, and then if I start feeling bad again, I take another dose. Sometimes I'll dose every like hour, and literally I feel great, and so it just allows me to continue through my day as if nothing's going on. Yes. Any other questions?
I'll throw one more out there. You mentioned also is it Rus Toxicodendron? Yeah.
Rus.
For like sprains and strains and things. Now is that more, that would work better than, again, Arnica? Or would you use those together as well?
Well, generally speaking, you can use both together, because generally when you have a sprain, it involves the tendon and usually the muscle surrounding it. So you can rub in some Arnica, take the Rus Tox. So, usually they're complementary. There's no rule that says you can only use one. So, I generally speaking, you could probably use both.
And in the Rus Tox, so if you have shingles or poison ivy or anything, so this actually, if you take it, will cure that? I mean, because I didn't think there was like a cure much for, once you break out, once that rash is there, like say chickenpox or shingles.
Well, it can substantially reduce the symptoms and shorten the duration. And again, I think the key is the timing.
Right.
The sooner you start it, the quicker it acts, and you won't even develop the symptoms. Now, I didn't go over, there is a protocol that I use for shingles and herpes, which is similar protocol. And that involves actually 3 different homeopathics. And that includes the Rhus tox, but the apis too. Because remember I mentioned the apis also can work for the herpes. And so and then there's another one I didn't talk about, which is called vaccinotoxinum. So there's a protocol where usually I have patients take as soon as they feel it coming on, because a lot of times you'll feel it before it actually even erupts. So at that point, you can take a dose of something called a vaccinotoxinum. Now that one's I didn't discuss that homeopathic, but this one is, I forget the exact, we can look at the exact, for the vaccinotoxinum, I forget this one is specifically can help though to prevent further outbreaks in the future. So I usually have patients take just 1 dose in the beginning, and then take a dose of the apis. And I'll have patients do apis every 15 minutes, and sometimes that will abort it completely, so that you don't even get an outbreak. If you miss that window and you end up, with the outbreak, with the rash, then you go to the Rhus tox, because it's that blistery rash. Then the Rhus tox, then the main one would be the Rhus tox. But sometimes you can just abort the whole thing with apis if you catch it early. So this is the kind of the beauty of homeopathics, and the timing sometimes is critical. So.
But the first one you said will actually, if you took that, prevent it, because I've had shingles, and I mean, if I took that, it might prevent that from happening.
Yeah, exactly. I mean, do you get it frequently, shingles?
No, but I've had it a few times.
Okay. Well, I guess with the vaccinotoxin, you can do that with the shingles. The shingles, people don't usually get shingles that often.
Right.
Probably more with the herpes outbreaks. People get those more recurrently, and so that usually the vaccinotoxin is great for preventing like the recurrence, but you can use it for shingles as well.
Vaccinotoxin.
Okay. Any other questions?
No, I think that what I took though to clear up
It's working. It's fabulous.
I mean,
Fabulous.
all of a
I
sudden
came in here
I'm not
sniffly
like,
and allergy, and I feel fine now.
Oh, okay, great. What did you take?
From one little
The
white.
vial.
yeah, I took it as well.
Oh, the Oscilla?
Yeah, this is phenomenal.
Okay.
And does it do allergies as much as, allergies caused by the same
Yeah, this thing.
things, like colds?
You took one
I mean,
whole
like with
thing.
cold come work, but
And get
allergies
the
too,
whole
if it's
chemical.
Well,
sniffles and...
there is again, I didn't go over, there's so many homeopathics, I didn't go over all of them, and there are some other ones for allergies, but sometimes when you don't know, the beauty of homeopathics too is it works on symptoms, right? So, whether sniffling and congestion is from allergies or from a cold, you can use, you could go ahead and use, the homeopathic that would treat those symptoms. But there are other homeopathics also that I use specifically more for allergies, if you know it's allergies.
And what's that?
Uh,
I mean, there's a lot of them. Not one in particular.
Well, there's a combination one that's very good called Sabadil,
Oh, let's spell it.
SAB
SAB.
ADIL,
API.
and that's a combination one that has multiple homeopathics in there, and that's a very good one for allergies.
Okay.
Now, if you're talking about like an allergy, like a true histamine response, there is this one specifically called histaminum, which is homeopathic histamine. So it's very good for like a classic histamine response allergy. Yeah, there's so many. I know. I'm telling you, I just went over just very few. There's so many. But I hope you got a taste of homeopathy and how it works, and just how it really can work in so many ways, and these are just simple ones I went over a few indications. A lot of these, again, they have multiple indications, and most homeopathics do have multiple indications. So I didn't really go into all the different indications, even with the ones that I presented, because it's really like when I was learning homeopathy, it's like it was like being in pharmacology class all over again. Actually, I think it's almost harder because you have one homeopathic that has targets, like 10 different targets, and so 10 to 20 different indications. And so it's usually when I was learning in pharmacology, you have one drug with one specific target, but then you have to learn all the side effects and all the contraindications and all the interactions. That's the difficult part. But here you've got one homeopathic that can be used for so many different things. So it's really when you look at a lot of these homeopathics, they'll just put on there the most common indication, right? So you'll just see one indication. So it's easy. I think it's difficult. I mean, it's good and it's bad, because I think what happens is this is what happens. People go to the store when they're looking for something, and they just look for the one indication. And sometimes they may get lucky, and then they pick the right one. But if they pick the wrong one and then it doesn't work, then because if you take something and it's not the right, maybe not necessarily the right one, it's not going to hurt you, but it may not do anything, and then people say, oh my gosh, this stuff doesn't work.
And taking them in conjunction with each other has no effect either.
Well, generally speaking, I don't recommend you don't take them together at the same time. Usually like to just space them. So if you're going to take one and then you want to take another one, I would probably wait about 15 minutes in between. Yeah, exactly. So, but that's what happens, I think, to some people, because people have told me that. Oh no, I bought one over the counter. I tried it. It didn't do anything. And then they discount the whole.
Right.
They say, okay, none of it works. So I've seen that happen. But that's why I say one good experience is all you need to become a believer, because it really can be miraculous, and I've experienced it over and over again.
Tonight, getting a miracle.
So are there different brands out there? And
Yeah, so there's a lot of different brands out there. I do like boron, which we have some samples available here tonight. But there's a lot of different homeopathic companies out there. A lot of companies actually that do the combinations, and some of them are very good as well. So there, again, there's over the counter. You can find a couple. You'll find several brands over the counter, and then there's ones that that we have here as well that come from Germany. I think mainly Germany. The ones that we have here as well, and most of them are combination ones. But I like to I learn them in their when you learn the specific homeopathic, and then you see it in a combination, right? When you see it in a combination, it's nice because you understand that specific one and why they kind of put them all together, because they all address different symptoms, and that's why they can put them together. But it's always nice to learn, the individual ones, because what I was taught that I think holds true is that if you pick the right one and you just have that one, it works better than if you just have a combination of them, and in the combination, not all of them, you really need all of them. I just find that if you pick the right one and you just use that one, you really get a better effect. But sometimes you do need the combination, and and that's fine. And it's really easy to just go to the store and pick up a combination one with all the different symptoms. If you're more sophisticated, you learn, study homeopathy, then you can really kind of target symptoms with the individual homeopathics. But that's difficult for just the probably more average person to do.
So if I was to take this, we'll call it Oslo for short, on a daily basis, would that be, it's not harmful at all? I mean, I found that it cleared up my nose.
Yeah,
It's wonderful.
it's unbelievable.
I mean, can I take it daily? Or that would be foolish, because basically it's saying that it's for more like flu-like symptoms, chills, and which I don't have.
Uh-huh.
So would it be unwise to take it every day?
Well, no, I think that in your situation, there's probably some more stuff going on. Were you feeling like you're coming down with something?
No, not at all.
No.
I just suffer with terrible allergies, but yet it cleared up my nose.
Because
You know, I
the
don't.
symptoms,
Uh-huh.
not the.
Right,
reason.
no.
Right. Well, you can. I would probably, have to talk to you a little bit more to see, like, to get a history, and because really, I didn't go into so much detail, but like I said, with homeopathy, to pick the right homeopathics for a person, I usually get a detailed history and figure out, what's the best homeopathic, not just for the, say, an acute symptom or one symptom,
Right.
but, is there something that you kind of fit?
Right, that I would be better off taking
Exactly.
rather than this. Yeah.
Right.
Mhm.
So, you could take this every day and it may work, but then it could wear off, maybe it stops working for you. And that can happen
Okay.
in some instances where, you have to find what's called the sensitive type for a person. So that's another talk. But for you, certainly, if it helped you, there's no problem, going ahead and using it. It's not going to, it's obviously.
And
not
one
gonna
brand
hurt you.
doesn't vary from the other. I mean, I'm sure this is one brand, that we were given a sample of, but there must be plenty on the
No.
market. No.
None of
Well,
this?
actually, for the oscillococcinum, I think
No,
this
this
is
is
Oh,
here.
interesting.
This is
Okay.
Where do you purchase
So
it?
you sell them here?
Anywhere.
Might as well.
You sell?
We do
Hopefully,
sell,
sure.
we do sell the different homeopathic
Yeah.
serums, including
So she's saying
oscillococcinum,
that
but
they
they sell them
might be
in
something
the,
that's even better.
like the markets,
Not a
like Whole
different
Foods and
No,
Sprouts
yes, I
and,
understand, of course.
what's the
Yeah,
other one?
because there's a
said
couple
they're
here that I
wrong.
want to give in my first aid kit.
Exactly, and I was just debating whether, I didn't do the first aid kit homeopathics, there's, I could have done that talk too, but there are definitely a lot of these are in there,
Yeah.
and the ones that I mentioned, and like I said, because of the timeliness of some of these, it's good to just carry them around with you, because if that happens and you have it, then you'll really see that how quickly it can work. Whereas if, like, that's why I tell people, okay, well, you got to get your oscillococcinum. It's flu season's coming, get your oscillococcinum, have it at home, because if you get the flu and then if you just start taking it right away, it'll be much better than if you wait a day or two and come see me or purchase it and just have it ready. A lot of these, they do have an expiration date on them, but a lot of them really, they're required to have an expiration date, but they don't really expire, so don't ever throw it away. Because they have a long shelf life anyway. So, it's okay to have it, because it's not going to really expire.